Hi, I will talk about pre-procedural evaluations of thyroid FNA. Written informed consent should be obtained from the patient. Informed consents should describe the procedure in detail, the complications that may occur with FNA, and the limitations of the procedure, such as inconclusive, false negative and false positive cytologic results. FNA is one of the very safe procedures. However, since the thyroid gland is an organ surrounding the airways, if hemostasis is not successful after FNA in patients with bleeding causes, an emergency, such as airway compression caused by hematoma, may occur in severe cases. Therefore, it is necessary to check the previous medical history related to the patient's hemorrhage cause and anticoagulant. Some studies have found that taking anticoagulants is not associated with the probability of FNA-related bleeding. But here I will explain precautions focusing on Korean guidelines. If the patient takes warfarin, it is recommended to stop 5 days before the procedure, and perform FNA if the international normalized ratio is less than 1.5 to 1.7. If the patient needs to remain in the antithrombotic state, there is also a method of stopping taking warfarin 2 days before the FNA. Performing a subcutaneous administration of enoxaparin every 12 hours and restarting warfarin the day after the FNA. The patient should continue to receive enoxaparin until the international normalized ratio reaches therapeutic levels. Patients who take antiplatelet drugs such as aspirin or clopidogrel, bisulfate should stop taking the medication 3 to 5 days prior to and 3 days after FNA. While discontinuing antithrombotic medications can reduce the chance of bleeding during the procedure, doing so may have serious negative effects on the patient's pre-existing condition. The decision to stop taking antithrombotic agents before FNA should be made in close consultation with the referring physician. When a patient has a bleeding tendency and FNA is necessary, the technique should be carried out carefully and with prolonged manual compression after FNA. A screening test for coagulation is not necessary before the procedure. Thank you.